We're talking to Ayurvedic Practitioner Donn Brennan today. Hi, Donn. How are you?
Hi, Joanne.
Donn, we've spoken in previous interviews about Ayurveda, but today let's talk more about Ayurvedic medicine and specifically massage. Is an Ayurvedic practitioner a licensed doctor?
An Ayurvedic practitioner should be licensed. Now, medical doctors, if they wish to practice Ayurveda, should sit a full course in order to get the appropriate qualification. For example, there used to be in Middlesex University in London an 18-month MSc course for doctors to integrate Ayurveda into their practice. However, Middlesex University is the first university outside India to offer a 4-year full training to become a practitioner, and this course is recognized by the Indian government. In India, it would be 5 years and then an intern year, much like modern medicine. Because in India, it's a huge tradition with maybe 400,000 Ayurvedic doctors and about 200 universities with departments of Ayurveda, and about 60,000 industries creating Ayurvedic herbal preparations. So it's quite massive, and they have a very established system of standards, and they're wishing to have that established around the world as the basis of training for Ayurvedic practitioners.
What is the aim of Ayurveda?
Bliss, health. If one is healthy, one is blissful. And the aim is Dharma, Artha, Kama, Moksha is how Ayurveda describes it. The purpose of Ayurveda is that you be able to be so vibrantly healthy as to fulfill your duty, your Dharma. Artha, to create wealth. Kama, to fulfill all your desires. And also Moksha, to achieve your full potential. That's the purpose of Ayurveda.
How is the Ayurveda different from, or the Ayurvedic medicines different from modern medicines?
So many differences. The doctor treats disease. The doctor is the expert. The disease is just, not related to lifestyle or a diet in many cases, not fully understood. And the patient is told what to do and takes the medicines. With Ayurveda, the patient is fundamentally what matters, because it's the patient who must take action to alter the factors that cause disease. The factors are understood in terms of lifestyle and diet and so forth, and it's not that it's difficult. Medicine sees lifestyle changes as very difficult. Ayurveda sees them as not difficult because people fundamentally know, but if they don't know, they just hear the Ayurvedic advice, do it, they feel better, and that brings great motivation. So Ayurveda is motivating, and it's not treating disease anyway. Ayurveda, as opposed to medicine, treats the patient.
The Ayurvedic medicines, do they have any side effects?
That's a very good question, an important one. There is in Ayurveda a tradition that came in the last 1,000 years of using heavy metals, and they underwent very sophisticated processes of purification. I wouldn't touch those particular medicines with a barge pole until the scientific research is done to show that they're safe. Other than that, Ayurvedic medicines are completely safe. But because of that, I'd be very careful about the preparations I would take from India. And in my own practice, I use Maharishi Ayurveda preparations and I use Pukka herb preparations, because in England, they have been independently tested and verified as safe.
I've heard that the Ayurvedic medicines need to be prepared in a special way. Is this true?
It's wonderfully sophisticated. It's like baking the most complex cake. And you use recipes that go back thousands of years. And the point is that if you use a single herb that's quite strong maybe and could potentially have some little challenging effects on the body and have some side effects. But in the Ayurvedic tradition, they tend to use 20, 30 herbs, roots, shoots, flowers, decocting, so they have over time developed so that these are actually safe, no side effects.
Can you suggest a safe remedy for stress that has no side effects?
Absolutely, yes. The best vaccine for stress is transcendental meditation. Twice a day, allowing the mind to quieten to that deepest level, such that through that habit, the ability to remain quiet and settled in the middle of the day, in the middle of the work. That technique has scientifically been verified at this point, and to be quite unique, different from other meditations, and quite profoundly healthy. People who use it end up in hospitals less, end up going to GPs less. They end up measuring younger than their biological age. Over the 80 years old, they live longer. And no other meditation has been shown to have such profound benefits, both for stress, anxiety. That's your best medicine.
So when I come to you, if I'm suffering from stress, you will work through all these things with me and explain to me how to do the techniques of the meditation, all of that?
If you come to me with stress, I would look at you and wonder, well, what is your nature? Because if, as Ayurveda describes you, you're a Vata nature, then you're going to respond to the stress of life with anxiety. If you're a Pitta, fiery sort of person, you're going to be angry, irritable, frustrated, annoyed. And if you're a Kapha, easygoing sort of nature, you're going to get depressed. So what I'm going to do is find out who you are and understand your life, your regime, and then make choices. If you're a Vata, anxious type, it'll be more restful, routine, meditation, massage. If you're more Pitta, fiery, I'm going to have to get you to chill out and just cool it. And if you're a Kapha type, I'm going to have to get you motivated to get on your bike and get moving. So it depends on the person.
Very fascinating. Don, are the Ayurvedic medicines okay for children?
Absolutely, absolutely. And actually we give the Ayurvedic medicines to the suckling infant through the mother's breast milk. We treat the mother and thereby treat the child.
With the Ayurvedic medicine and the Ayurvedic massage, tell me a little bit about the massage and what the benefits are of the massage part of it.
Aha, now you're into a huge topic. Something we haven't mentioned is the whole strategy of detox, of eliminating toxins from the body, which those toxins are fat soluble because we can get rid of water soluble toxins as we urinate, but fat soluble toxins end up dissolved in us. And so Ayurveda uses profound strategies of oiling first, including oil massage, and then heating, steam baths or hot oil massages. That opens channels to the tissues and dissolves toxins, which are then drawn to the gut, where various purgative or inhibitor type treatments can clear the toxins. This is a very sophisticated science of detoxing. But from that aspect of Ayurveda has come all these wonderful massage traditions, various types of massage for different things. So the skin is an organ which absorbs and digests. So through the skin, we can give the oils which are then carrying the herbal qualities with which they've been processed deep into our tissues for a very healing effect. And so it's both healing, detoxing, and nourishing.
Thank you, Don. It's been an absolutely fascinating discussion. Thank you for talking to me.
A pleasure, Johan.